Are you or someone you love having vertigo attacks that come out of nowhere and last for hours? Do these attacks completely debilitate you, making it impossible to work or drive? This type of episodic vertigo happens spontaneously to many people and often goes undiagnosed. Many patients with these type of spontaneous episodic vertigo attacks are simply diagnosed as vertigo, and they're told they have to live with it, never knowing the root cause. This leaves many patients bewildered, frustrated, and uncertain what to do next. In this video, I will talk about 3 potential causes of these type of vertigo attacks. Make sure you stick around to the end because I am going to share one common risk factor that I find in many patients with these type of spontaneous episodes of vertigo that are completely debilitating. But first, just a reminder, I am Kim Bell. I'm a licensed physical therapist and the vertigo detective, and this video is intended for educational and informational purposes only to offer you hope that you can get your life back. This is not intended as individual medical advice, so be sure you talk to your own healthcare providers about your own case to get individual medical advice. So let's take a look at some common causes of these vertigo attacks that we're talking about here. One of the most common causes of vertigo attacks that seem to come out of nowhere and last for anywhere from minutes to hours, even up to a few days, would be vestibular migraines. I wrote an article about this here. If you go to vertigodetective.com and look at my blog called Vestibular Migraines. Here it is. Just move it over for you there. It's a root cause of vertigo. And in this article, I talk about how long they last, lasting for anywhere from 5 minutes up to 72 hours. That's 3 days. And then some patients, it can take weeks for them to recover from a severe vestibular migraine. How often are people getting them? That varies case by case. In this article, I discuss different symptoms of vestibular migraine, so you can start to think about, does this sound like you? Some typical co-occurring symptoms would be a heightened sensitivity to sound or light or even smell in some cases. Some patients can track these episodes to specific triggers like certain foods, stress, alcohol, missing a night of sleep, traveling. Different typical migraine triggers can also set off a vestibular migraine. Now, one of the reasons this type of root cause for spontaneous vertigo attacks goes unaddressed, overlooked, undiagnosed is because vestibular migraines don't always come with any pain in the head. So they can be a spontaneous attack of dizziness, vertigo, imbalance, nausea, and even vomiting without a headache. And therefore, people aren't even considering that this could be a migraine event. However, these only occur in people that either have a personal history or a family history of migraines. So a history of migraines is important to determine if this might be a root cause of dizziness or vertigo attacks in your case. And again, you can look here for more information, talk to your doctor, especially if you have a personal history or a family history of migraines. Now, I want to move on to the second possible cause of spontaneous attacks of dizziness or vertigo that can be completely debilitating, seemingly coming out of nowhere. The second cause would be Meniere's disease. Now, I will qualify this statement by saying that this is, in my opinion, one of the most overdiagnosed and incorrectly diagnosed root causes of vertigo. Most people have not had a full workup to adequately assess whether they really have Meniere's disease, but this has sort of just been assigned to their case as a guess by a doctor who doesn't necessarily specialize in dizziness or vertigo in a lot of cases I've seen. So in this article I wrote, again, on vertigodetective.com, I talk about the question I frequently hear, which is patients that say, do I really have Meniere's disease? And so in this article, I talk about different symptoms and patterns. I want to emphasize that Meniere's disease classic Meniere's disease typically fits a pattern where the patient can have spontaneous or recurrent episodes of dizziness or vertigo that can last for anywhere from 20 minutes to 4 hours and even potentially last up to 12 hours. These episodes are typically accompanied by nausea, vomiting, imbalance, as well as pressure or fullness in the ear, the affected ear, ringing, rushing, or roaring sounds in the ear, and an intermittent hearing loss, which is not permanent after the episode of Meniere's has resolved. Meniere's disease usually affects only one ear, but both ears can be affected in some cases. Now, one thing that's interesting is patients can have migraines and Meniere's disease, and in that case, one of the really smart neurologists that I have the privilege of working with assigns a diagnosis, what he calls a Meniere's migraine variant, or MMV. And so in those cases, whether it's a vestibular migraine causing vertigo attacks, or a Meniere's disease, a true classic Meniere's disease, or some kind of Meniere's migraine variant, which sort of, in his opinion, occurs along a spectrum, regardless of which root cause, typically you're going to need medical management. That would be prescription medications or suggested supplements to deal with whatever the root cause of these attacks are. So many patients will end up having a preventative regimen of medications or supplements that they take regularly to prevent these type of attacks. And they will have what are called abortive therapies. So prescription drugs or supplements that they can take when they feel an attack starting, and that will hopefully reduce the severity of the vertigo attack or how long it lasts. So again, medical management is a key for patients with any of the diagnoses I mentioned, either vestibular migraines, Meniere's disease, or some kind of Meniere's migraine variant. And of course, there's more detail in all of those discussion areas, but this video is just an overview of what might be causing spontaneous vertigo attacks. And now, as promised, I want to mention one of the most common root causes of all of these different diagnoses that are related to spontaneous vertigo attacks is upper cervical problems. Okay, so final resource I want to share with you would be related to upper cervical dizziness. So if you feel like you have neck pain, neck tension, noises in your neck when you turn your head side to side, does your neck feel stiff? Do you have a history of neck trauma? If you say yes to any of those things, then it's possible that the neck can be one of the deeper root causes of these spontaneous vertigo attacks. The neck can cause recurrent migraines, can increase the frequency of migraines for patients who get migraines, and the neck can cause these Meniere's-like attacks that would fall more under a Meniere's syndrome type of a diagnosis. So it's not a true Meniere's disease, but it mimics Meniere's disease with a specific root cause that can be addressed, such as the neck. So I'll leave you there with this resource. If you want to learn more about the neck as a potential root cause of spontaneous vertigo attacks that last for hours, you can check out this article here at vertigodetective.com. God bless you. Have a great day.